Hey everybody, thank you so much for tuning in today. I am here with Dr. C. She's a naturopathic physician from Spark Health down in Solana Beach in California. And I've had the privilege of working with her, meeting with her in person for a variety of things. And she's an amazing doctor. So I thought it would be great to bring her on today to talk a little bit about how to stay healthy during this time in our lives right now, all this craziness, and some exciting new antibody testing that they're doing. So Dr. C, do you want to tell everybody a little bit about you and kind of what your background is?
Sure. So I'm a naturopathic doctor. I have a practice called Spark Health in Solana Beach. We focus on personalized natural medicine. So helping people get to really optimal health. And, we don't just use things. We use prescription medications, natural supplements, IV therapies, intramuscular injections. We have pretty much every tool in the toolbox you could ever hope for. But our focus is really on maintaining wellness, preventing disease, and giving people proactive things that they can do to maintain their health, and hopefully prevent the things that we usually deal with as people get older, because we're focusing on our health and wellness in the moment and not waiting for an issue to arise.
Yeah, and I can speak to that completely. You guys do a really great job at that. And every time I'm in California, I love to come to your clinic and get IV therapy. It's my favorite thing in the world. And I've been doing it long before they offered it here in Utah. So when they started doing it here, it was exciting. But so first and foremost, I would love for you to tell everybody a little bit about your new antibody testing for COVID. I know it's kind of a new thing right now, and there are a lot of questions around it. I know that I have a lot of curiosity around it too. So if you could tell us a little bit about that and what you guys are doing with that, that would be great.
Sure. So the laboratory that's offering the testing is called Vibrant America, and they're based out of Northern California. We've used them for our routine lab testing almost from the beginning of when I opened the practice, so about 6 years now. They have gone through FDA validation. They're in the process right now. They've given notification to the FDA, and they're in the approvals process, but that's a really long process. So testing that's done now is a lot of times just meeting very minimal requirements to be able to be performed under, it's called the emergency use authorization. So in times like this, they understand that people need to have access to testing, and that this is how we really build research, right, and build data, is by doing this type of testing that helps us discover a lot of the information that we don't know. So the testing is great. I think it gives people a lot of information about themselves, right? We can figure out what's going on if we've had exposure, if we have active exposure. But I also look at it as it's part of really performing a service for our community, and really looking at it from a public health perspective, because it's helping to identify people that are asymptomatic and that could be unknowingly spreading the virus. And if we're talking about stopping the spread and flattening the curve, that's what we really need to find out. So the testing is a blood draw. So right now we do the blood draws here in our office. The lab is actually going through an FDA approval process for a finger stick that you would perform at home and then send into the lab, and your doctor would receive your results. So it's not one of the ones, I don't know what's happening where you are, but in California, there are all of these things popping up where plastic surgeons are now testing for COVID, and they have drive-by in a college parking lot type testing that's all kind of, it started out and then is being shut down. But this is not that. This is a test that's sent in. It goes through the lab analysis. It's not just something that pops up right away with results. So they're working on that right now, so that patients all over the country would be able to do it. Right now, it's patients coming in for a blood draw. So we always want to talk to each other. Your doctor and a patient should always be in communication about what the patient's health history is, if anything new has come up, why we're doing the testing, what we're looking for, because that gives us information for how we interpret those results, especially when things are so new right now, right? This testing is new, interpretation is new, and we're trying to, as naturopathic doctors and functional medicine doctors, really be on the forefront of what's happening and help contribute to the research, so that we start getting answers for our patients and we have proactive steps that they can take.
Is it a test where you would get it if you feel like you've been exposed, or is it a test where you get to see if you have an antibody, so that you would know if you could get it or if you've maybe had it in the past?
Yeah, so both. So I think it's something that in my ideal world, everybody would have access to it, and everyone would be getting tested, because it tells us, I think it tells us a few things. So the first thing that it tells us, it looks at these different antibodies. So antibodies are these substances that our immune system makes in response to an infection. And we have different types of antibodies because we have different types of responses. So when we're first come in contact with the virus, or we're first exposed to it, we create an antibody called IgM. So all the antibodies are called Ig for immunoglobulins. So it's IgM. M is what we start producing when we have that acute exposure. So for this test, it's looking at about 3 to 17 days post-exposure. That can vary depending on the individual, depending on their immune system, but for the most part, we're looking at 3 to 17 days post-exposure that IgM shows up. I think that's super, super important, because if somebody is having symptoms and they're not able to get like the nasopharyngeal swab to check, the IgM can kind of clue doctors in to know that something could be going on, so they can get a swab. But it also does give information about what's happening in the immune system and how our body is mounting that immune response. So what I'm seeing in my practice with the tests that we've done so far that have come back are that when we're seeing a lot of negatives, which is good. People have not had that exposure, but I am seeing quite a few of the IgM positive tests.
Okay.
They're all in patients that do not have symptoms. Patients can develop symptoms, right? You can develop symptoms. That's part of the issue with COVID, right? Is symptoms can show up a week, 2 weeks after you've been exposed. So you can have been exposed and be carrying this virus and transmitting it and not know. And that's why I think the IgM is super, super important from a public health perspective, because we're helping to identify patients that otherwise would unknowingly be transmitting the virus to their communities. And that's why I think that's super important. It then helps us to say, okay, great. You are completely self-isolating and self-quarantining for the next 2 weeks, and then we'll retest.
Yeah, okay.
What we see when we retest, hopefully, and what we see in patients that have had previous exposure to an infection with the virus is we see an antibody high or positive called IgG, so immunoglobulin G. So you have the IgG antibody to COVID if you have had past exposure. So a previous illness, or you were exposed to it and you didn't get sick.
Okay.
I have 2 of my 3 patients that I talked to today with positive IgGs. 2 of them had no illnesses at all, had no idea. One had been really sick back in January.
Okay.
So it gives you an idea of if your body has seen this virus before, if your immune system has seen it and recognized it and mounted an immune response to it. I would say the jury is still out on what having that positive IgG test means.
Yeah.
Some viruses, if you have been in contact with that virus or exposed to that virus just once, like something like really simple, like the chicken pox,
Yeah.
right? If you've had the chicken pox, you usually don't get it again. You usually have some type of immune response, and your body mounts that immune response, and then your body kind of mounts this response. You create these antibodies. And so if you were to come in contact with it again, it would recognize it.
Yeah.
So you have different types of viruses. Some do that. Some you can have the virus, you can have a response to it, and you can have that same infection and response again, right? So if you think about something really simple like cold sores, right?
Yeah.
Like herpes or something like that, you can actually have that over and over and over and over again and still have a response.
So with COVID,
Yeah.
you can get it, or you can be exposed to it. You can recover, and 5 months later, come in contact again. It's possible that you could get it again. Jury's out, right? So that's because I'm gonna guess it's so new and we don't know.
Yep. And that's the thing is we don't know. We don't know. We don't have enough information yet to know exactly what that looks like. I mean, if you think about it just from viruses in general, you think that, yes, having exposure to a virus, your body does recognize it in some way. So even if you had the ability to get infected again,
Mm-hmm.
you could,
Yeah.
but who knows, right? You just don't know what that's going to look like. You just don't know.
Yeah.
So
Yeah. That's very interesting. So if somebody were to want to get, I don't know of anywhere here offering the test yet, but if someone were to want to work with you guys, are you able to do telemedicine like this and send a lab order to go to a lab and get the blood draw if they wanted to do that and then be your patient?
so I
Or would
don't
they actually need to be there?
Yeah, so I don't know who's drawing out of state. I don't know. So for
Oh,
Vibrant
yeah.
Laboratory, I don't know where they would get that draw. So my feeling is hopefully once the finger stick is approved, then that would give us the ability to do telemedicine, to be able to have these consults with patients, to get them the test, have them submit the test, and then do an appointment with them after to follow up with those results. But until that finger stick happens, there's not really a way for patients to get that. I shouldn't say that. There may be a place where that lab could be drawn out of state, but it would be with each individual state. We'd have to find somewhere that does draws for this specific lab, because everything, the blood gets processed in a specific way and then overnighted to the lab in Northern California.
You're
So
right. Right after I said that, I remembered that I've had like a food allergy test before, and they said, I went to LabCorp and they said, oh, we can't do this. I don't know what this is. It's not in our system. So that makes a lot of sense.
and
So,
there are other labs like Quest, which is a lab that's all over the country,
yeah.
they just released a COVID antibody test too. So it just depends
Oh,
which laboratory the doctor is working with.
yeah.
We haven't talked to Quest yet to find out more about that test yet.
Okay. So with all of this going on, everyone's talking about how to boost your immune system to fight off COVID. So I hear a lot of things, take zinc and vitamin C and all these different things. But I think what's happening is people are so hyper focused on that because they're so terrified of getting it that they're not thinking about everything else and keeping their mindset right and the rest of their body healthy so it's not inflamed. So can you talk a little bit to that and just in generalities what people need to do and just remember it's not just about COVID, it's about the whole body, the whole picture.
Exactly. You're a person outside of worrying about a virus, right? And
Yeah.
look, there's nothing that we can specifically do that can 100% prevent the virus, right? You can have all the personal protective equipment, you can have all of the great hygiene, you can be taking your supplements. That doesn't guarantee that you will not get it. So I think all of those things are super important, right? I'm a huge proponent of that. I think, and my mom always used to say, better safe than sorry. And I think that really is applicable here. I don't want people being super worried or hysterical about it, but I think that it's important that we are vigilant about what we do. That being said, yes, supplements can be helpful. Vitamin C, vitamin D, vitamin A, zinc, elderberry, all of those things, other herbs that have antiviral and antibacterial properties. Yes, that is important, right? Everything we can do to kind of boost our immune system is great. But we also have to focus on the basics. Are we eating well?
Yeah.
Are we getting good sleep? This is a really stressful time. Are we managing our stress well? That I think is the number one thing that I see as issues for my patients right now is they're stressed financially. They're stressed with their kids at home trying to homeschool them. They're stressed with having a lack of outlet, which is usually like exercise, and especially here in San Diego, getting outside, going to the beach, getting in the water, getting on their surfboard. So all of the things that they normally do for stress relief, they're not really able to do in the same way. So I think finding something that allows you to manage your stress is super important.
Yeah.
Hydrating, like those basic things, right? Are you eating? Are you sleeping? Are you drinking? Are you pooping, right? Those basic things, those have to be in place. And then we have to delve a little bit deeper and remember everything that we do on a day-to-day basis to keep ourselves healthy and strong and functioning properly, we still have to keep doing even with COVID.
Yeah.
So we have to do that. We have to make sure that we're still taking care of everything that normally keeps us healthy and strong. So if you have thyroid issues, are you making sure that your thyroid levels are balanced? What does your vitamin D level look like? Do you have issues with thyroid? And do you have issues with hormones? Do you have issues with iron? Do you have issues with how your body stores iron? Like all of those things are super, super important to do.
Yeah. Yeah. Yeah, that makes complete sense. And I do think when people get really, really stressed, that's the time when all the other breakdowns start to happen. Um,
Mm-hmm.
and I think, inflammation in the body can be so catastrophic. I mean, it can cause so many issues, and it can cause all of those things, adrenal fatigue, that lack of sleep. I know for me, I have to exercise. And so, with gyms being closed and things like that, there's a lot of people that don't have the ability to work out at all. And depending on where they live in the world, even going outside can be a challenge depending on the weather. It's finally getting warmer, but it hasn't been that the whole entire time we've been going through this. So so it's just important to probably take multivitamin and just take all those precautions. But anything else you could provide as tips to just stay well in
I mean,
general?
I think people need, just recognizing that this is going to pass.
Hmm.
This is something that we have to do right now. And it's not ideal for anybody, but if we're looking at keeping ourselves healthy, if we're looking at keeping our communities healthy, to make sure that we're doing everything that we can now so that this isn't something that's ongoing and ongoing and ongoing and it never goes away. So it's kind of like the short-term risk for the long-term benefit right now,
Yeah.
where we're doing what we have to do right now. And I know people are getting frustrated, people are getting tired of it, it feels like it's dragging out, but
Yeah.
it's just been a very short period of time, right? It's been a month. And so
Yeah.
I think if we can look at it as keep being vigilant about what you're doing, don't get lax on things, keep doing the things and following the guidelines. I'm not saying we have a perfect system set up there, it's certainly not, and it's not ideal.
Yeah.
I would certainly rather it's 75 degrees here. I'd certainly rather be at the beach too. But doing the things that we can do to, as much as we can, halt the spread of the virus and start getting back to normal day-to-day functioning. Because if we can keep this controlled shorter term, I think longer term, we're going to have a better shot at getting back to what we all want. So it's frustrating, but keep doing what we need to do to protect ourselves. I think that's important too, even with the testing we were talking about, right? I did
Yeah.
my testing, everything came back negative. You know what that told me? I'm doing a really good job at protecting myself.
Yeah.
Everything that I'm doing, all the sanitizing I'm doing, all my protective equipment, limiting my exposure, social distancing, everything that I'm doing, it is working. My IVs that I'm doing every week, like the things that I'm doing to take care of myself are helping to keep me healthy. And I think that's the important take home for everybody too. Keep doing what you're doing to keep your bodies healthy.
Yeah.
Yeah.
Perfect. I love it. So tell everybody how to get in contact with you. I'll link to your website and everything as well, but let everybody know how to get in contact with you. And if somebody wanted to work with you, what that process would look like.
So our website is mysparkhealth.com.
Okay.
Our email is spark@mysparkhealth.com. It's very simple. And our phone number is 858-228-4188. So you can give us a call. If you're a new patient and want to work with us, we would just set up an appointment to establish care. So with all of our patients, it doesn't matter if you're over the phone or over Zoom or here in the office, we always do an initial appointment to establish care because that's our chance to get to know each other and to understand why we're testing the things we're testing, what we're looking for. We map out our game plan. We don't just run every test possible. We look at what are the targeted tests that make sense for you to do. And then we go through the workup, lab testing, lab kits, whatever we need to do, get those results back, and then come back together and do an appointment and talk through what all those results mean, how they impact your health goals and challenges, and what that treatment plan looks like for you. So
And
it's a
you
process, but it's not crazy long or crazy involved.
and you
Just
do Zoom appointments like this you work with people all over the country, the world, right?
absolutely. Yep.
Okay. And you guys are on social media. So
Spark Health.
yeah. And you guys have a really great newsletter. I subscribe to it, so I get all of your newsletters. So if someone were to go to your website, I'm assuming they could just sign up for that.
Exactly. Go to the website and there's a whole section where you can sign up to get our newsletters also.
Okay. Well, you've been so amazing and so informative, and I really appreciate you taking the time out. I know you're so busy as a doctor, so thank you again, and you stay well and healthy, and hopefully you can get to the beach soon. And as
Thanks.
soon as I can get on a plane, I'll be coming to the clinic with IV.
Okay.
All right, take care. See ya.